Hi everyone, I'm Dr. Bharti Bhojwani. I want to share a few dental health care tips to maintain good oral hygiene. Brushing at night is utmost important since the plaque remains in action the whole night. Modified Bars technique is the best method of brushing. As you can see in the picture, hold the brush just a little above the junction of tooth and gums at a 45-degree angle and brush vertically downwards on the upper teeth and vertically upwards on the lower teeth on the labial and lingual outer and inner surfaces. You can brush horizontally in a to and fro manner on the occlusal surface. Clean the distal surfaces of the last molars. Take a little extra effort, tilt the toothbrush and clean the distal surfaces of the last molars, and after brushing, massage your gums with finger to increase the blood circulation in the gums. You do not need any medicine to massage the gums every day. The best toothbrush which I suggest is a soft toothbrush from the age of 12 years to 50-55, and then you can switch on to ultrasoft toothbrush. Be gentle to your teeth and gums. If you brush horizontally with too much pressure, or if you brush with a hard toothbrush, enamel starts wearing off and such wedge-shaped cavities are formed, as you can see in the picture. If these cavities deepen, the teeth may become sensitive and you may sometimes need a root canal treatment. So be very gentle and value the 32 pearls which God has given you free. Avoid highly abrasive tooth powders and try to use a toothpaste with minimum abrasives. And there is no need to use such large quantity of toothpaste, just a pea-sized toothpaste is enough. Brushing technique is more important than the quantity of the toothpaste. The snacks in between meals preferred are fruits, dry fruits, peanuts, and any non-sticky snack. It's better if you avoid chocolates, sweetened drinks, any sticky foods, cakes, pastries, extra. You can have sweets, cakes along with your main meals. Since during your main meals, there is a lot of salivation and the teeth surfaces get cleaned on their own. The sweets don't stick and they don't remain there for long hours. So it is always preferable to have sweets along with your main meals, either in between or just before you start your meal, and not the last thing. Normally we have dessert in the end. No, if you have it in the end, then again they'll stick. They'll be there on the teeth for a long time. So it is always best to have anything sweet in between meals or just before you start the meal. Never use a toothpick to remove the stuck food particles between teeth. Instead, you use an interdental brush. See, these are very thin, small brushes with soft bristles which will clean the interdental areas without causing any damage to your gums. You can use dental floss. To maintain gums in good health, floss every day at night before brushing. Flossing removes the food particles between the teeth. Now, once these food particles and plaque are loosened by the dental floss, the toothbrush will brush them away. The method is you insert the floss in between the teeth and clean it in a to and fro motion, and you remove it from the front. Don't clean it in an up and down motion. Now, there's a confusion whether you should use a mouthwash or no. See, not everyone needs a branded mouthwash. Mouthwash can be used when it is prescribed by your dentist. Otherwise, normally the best mouthwash is hot water. One should gargle at least once a day with hot water. If you want to put, you can put turmeric or clove powder on it. And otherwise also that during the whole day, whenever anything enters your mouth, whether it is tea, coffee, cold drink, or your main meals or your snacks, it is always preferred that you gargle with normal water. If you can't get up again and again to gargle, you should keep a water bottle. You can sip in one or two sips of water, swish it in the mouth and take it in. So keep your mouth clean. Now, have you ever heard of a water flosser? It's it's very nice to use it in case you have artificial teeth, bridges, implants, or spaces in gums, or there's severe foot lodgement. Then you can use a water flosser. Interdental area is cleaned with a powerful jet of water. Last but the most important thing is oil pulling, which I want to tell you about oil pulling. If oil pulling is done regularly, it keeps your teeth and gums healthy as well as it removes toxins from the body. And the main thing is it boosts your immunity. So during this lockdown period, it is very advisable to use oil to do oil pulling. Early morning, you take 5 to 10 ml virgin edible coconut oil without any preservatives. Swish it in your mouth early morning, the first thing in the morning for 2 to 15 minutes and then spit it out. Gargle and brush your teeth. Never drink it after swishing it in the mouth. Use it at least for a month and you can see the magical results yourself. Now, in case if you have a very little slight pain due to some reason, you can apply turmeric mixed in mustard oil and you can apply mucopain, dolo gel. But if you get severe pain or swelling or bleeding gums, then you consult your dentist. Thank you very much.